Good afternoon, everyone. I'm Becky Wittes, Chairman of the Niagara County Legislature. Thank you for joining us on our daily live Niagara County COVID-19 update on LCTV. We are currently also streaming on lctv.net as well as on your radio at 90.9 FM. Again, we thank LCTV for this partnership. It's been a wonderful way for us to get the information out to the residents daily on what's happening in your communities. We've also invited all of our local media outlets, news stations, to share this live broadcast or, of course, use pieces and clips for their updates later in the day. If you missed the live version, LCTV does replay this briefing several times during the evening as their schedule allows. You can also find it in the Niagara County Legislature page of their on-demand section of lctv.net, and we will post it when it's available on the Niagara County Facebook page as well. So again, thank you for joining us. Today with me in the studio, I am being joined by Niagara County Director of Emergency Services, Jonathan Schultz, who's going to talk to us a little bit about his job and what he's doing with his department. But first, let me provide you with the daily COVID-19 update numbers. The governor this morning on his live briefing announced that in New York State we have 83,712 positive cases of COVID-19, and the fatality total is up to 1,941, with more than half of these cases, of course, being in the New York City area. One bright spot, the good news, is that we've also had 6,142 people throughout the state released from the hospital home and doing well, and that is certainly good news to hear. In Niagara County, today we have 9 new positive cases. That gives us a total of 65 to date. There are 54 positive individuals in isolation, 39 are isolating at home, 15 are in hospital isolation, 11 people have recovered. We currently have 84 people in quarantine and 92 that have completed their quarantine. So again, these are good numbers that we're hearing as well on top of our new positive cases. The Niagara County heat map has been updated. You're seeing that on your screen. That map breaks down our positive cases by municipality. The link can be found at niagaracounty.com. At the top of the page in the COVID-19 banner, there's a link for that map so that you can check those numbers. Not surprisingly, our cases continue to grow in our most densely populated areas, of course, but the uptick will continue across the country. As we have repeatedly said, act as if it's everywhere. We know that it is. We'll reiterate, of course, that we believe that these numbers would be much higher if we were doing the testing that we would like to be doing in the area. That lack of testing, of course, is keeping our numbers low. Along those lines, some of you might have heard from a friend or a relative or a neighbor who had symptoms and their doctors told them to stay at home and to self-isolate and treat their symptoms. Just like the flu or the common cold, they'll ride it out, they'll get it better. That's the best case scenario. Those folks will not be included in our positive count numbers because they were not tested. We don't know if it's the seasonal flu or if it's something else. So the numbers will never capture the entire picture of what's happening. Lack of testing supplies and PPE overall continues to be a frustration in our county as well as many others. Joined by Jonathan Schultz, again, Director of Emergency Services for Niagara County. And John, first of all, could you talk about your role as the head of emergency services when we're in a state of emergency like COVID-19?
Certainly. You know, as a director, you know, our Department of Emergency Services, we're faced with basically being conductors for the county, working with all our first responders, our healthcare facilities, and other facilities across the region to get them the supplies they need to make sure they're prepared to basically help all our citizens across Niagara County. So basically, we provide the best effort we can for them.
Okay, so procuring those supplies is your job then?
Yeah, you know, it's a tireless effort. You know, my staff is working practically around the clock, trying to work with the state and other facilities to get those PPEs that we need and other things out there to get us to protect everyone.
We heard so much about PPE now. Can you tell everyone, maybe people don't know, what does PPE stand for and what does that include?
Certainly. You know, it's personal protective equipment, and there's various types of equipment out there. One of the biggest things you hear about are the N95 masks. Those are the medical grade masks that people need to be fit tested for so they get the proper fit. So when they're wearing them, they don't actually get any type of infection or the virus gets through and they get infected with it. Then we have the medical isolation masks, which you'll see many people wearing them inappropriately. Unfortunately, out in the public, you'll see people wearing them. They really shouldn't be. Those are the ones that we're getting out there to have available for those people that are sick. when we're treating them. And also many of the healthcare facilities, they're using those as well when they're treating just your normal patients, so we're not transferring any type of a virus or anything else across the way.
Okay. So if PPE comes from you then, where does it go from there? If once you get it, what happens to it? What's the distribution plan, if you will?
So the distribution plan is, we're fortunate we do get some supplies from New York State. Unfortunately, doesn't even come close to what our needs are for our community is. We get a certain amount of masks in, we get some gloves, we get some gowns, and it really doesn't even meet the percentage of what we need for the community, for our first responders, for our healthcare facilities. We're getting about 5% of what the actual requests are for everyone across the board.
Wow, okay. And I heard that you had a shipment that came in last night. Where does that stand?
We did. We got a shipment in about 7:30 last night. We did get it organized last night, and probably about 3 o'clock today, all those PPE, personal protective equipment, will be out to all of our facilities across the county, the healthcare facilities that have really been requesting it.
So that supply came in, it's immediately dispersed and gone.
Yeah, literally we make phone calls to the facilities, and they have people out to pick the stuff up within half hour, 45 minutes, because they're in dire needs of getting that equipment.
Okay. So if it goes out that fast, and it's simply out until your next shipment, can the county directly buy from other sources?
We, think yourself and the rest of the legislature. We have been reaching out now and procuring as much supplies as we can. We do have large orders for N95 masks, which probably won't be in for 2 to 3 weeks. We have placed orders for isolation masks as well, and gloves and gowns and things, and face shields, to try to get a surplus going to help meet the needs of the community, because currently, unfortunately, it's just not being met.
Okay. And of course, you're really firsthand every day, on the ground with all of our first responders and working very closely with them. What are you hearing and seeing from them?
It's a lot of stress out there in the first response community. I can tell you, our volunteer community is doing amazing things. Our career departments are doing amazing things. The commercial ambulances, everyone out in the front lines, I can't say enough for them. I know we keep our physical distancing at this point, but when you see them out there, thank them. When this is all over, thank them for what they're doing. They're doing the best they can, with what PPE they have available. They're doing many limiting resources and responses going. They're limiting the amount of people going up to a residence, just to limit that risk so we don't have that exposure for the potential for the virus.
I think it's very important to thank them.
Absolutely.
Thank them on our behalf as you see them.
Absolutely.
Certainly we know the stress that they're under right now, and really dealing with extraordinary circumstances and trying to figure things out as we go, like everyone is right now. So yes, thank you to you and your team as well, of course, for everything that you're doing for our county right now.
Thank you.
Before we wrap up, certainly COVID-19 has kind of taken everyone's collective attention lately, but there are other concerns. There are other things still happening, like our Lake Ontario water levels. Where does that stand, and what's happening at this point?
Unfortunately, the Lake Ontario issue hasn't gone away as much as we wish it would have this year with the COVID-19 happening and things. Just this morning I was out meeting with some of our municipal leaders for planning for what we're going to do when this flooding starts again. Just today we're about 0.6 inches higher than we were last year at the same time. So we're already into the motions of setting up, bringing sandbags in, water bladders, and pumps. So we're ready to go in the next 2 to 3 months when the water levels come back up to where they were possibly like last year, to protect our community and make sure we can try to get those businesses open when we get past this virus, so we can try to do the best we can for our communities.
All right, thank you, Jonathan.
Thank you.
Thank you for joining us and answering these questions.
Thank you.
We appreciate it. Just a couple of quick items to update you on again. I want to again share a note from County Clerk Joe Dostremski. We mentioned yesterday that there had been an update in the issue of vehicle inspections by the governor. Again, we want to let you know that if your inspection is up at the end of March, if it just expired, that inspection date has been extended. You do not need to go get that updated until further notice. But again, if it expired before that, January, February, you'll want to make sure that you take care of that inspection. But as of now, a March inspection date or later is extended. Today is also Census Day. It's another one of those big things that people are probably forgetting about because there are much bigger things going on, and the talk is all about COVID-19, but don't forget that it's Census Day, folks, and it's very important for you to fill out that information and get it turned in. Many of the things we see in the community are congressional representation, our federal aid, grants. Those things are all based on population levels. So it's very important that we get a true and accurate count through the census, which is still ongoing at this time. I can say proudly that Niagara County is leading the state with a 41% response rate so far, which is 10% better than the state average. So thank you all. I know while you're home, you might have some extra time to do paperwork and things like that while you're not working. So please, again, make sure that you're filling out that census paperwork and getting it turned in when you're able to. Yesterday, we had Laura Kellerman from the Mental Health Department join us to talk a little bit about stress and how to handle the issues that come up during a crisis like this. So again, I just want to remind everyone that our mental health crisis services line is available for you 24/7. That's free and confidential. You can call anytime. They will help you if you're experiencing anxiety or stress over the current situation and the unknown pieces of where our community is going, what's going to happen in the future. Or if you have a friend or a loved one that's experiencing those things and you need a little bit of advice, please call them. Again, the number is 285-3515. That's Crisis Services for Niagara County Mental Health Department at 285-3515. Thank you all for joining us today. I would again remind you, please follow those guidelines. Keep yourself home and distanced from others as much as possible. We know this is everywhere. Our numbers will continue to rise. We know that. Really just that physical distancing of yourself from others is really the most important thing that you can do for yourself and for other people right now. Get outside, take a walk, but do those things safely and at a distance from other individuals. Stay home, stay safe, and stay healthy. Take care, and we'll see you tomorrow.